Brazil has been a Latin American leader in fighting the coronavirus, but it wasn't always that way. The country was battered by the COVID-19 pandemic, with 618,000 deaths, its second only to the United States for the number of fatalities. Now infections in Brazil have plummeted due to high vaccination rates. Nearly 80% of adults have been vaccinated at least once. But fear remains, particularly as the country prepares for the impact of the new Omicron variant. Welcome to your COVID-19 special. I'm Daniel Winter. Brazil is ending the year on a high, not of COVID cases like some countries, but vaccinations. Let's take a look now at how the country faced down mounting deaths and a president who downplayed the impact of the virus to become one of the world's most vaccinated populations against COVID.
Hardly anyone in the world thought it possible a year ago. The corridor of this hospital in the Brazilian city of Toledo is deserted. A lot of the emergency equipment has been put away in the storage room. This is the result of what might be Brazil's most successful vaccination drive against COVID-19.
We used to have 40 intubated patients here, now we don't have any. And it's very rare for us these days to have to provide that level of intensive care. The cases are also much less severe than before, so we can think more carefully about how best to treat those who are sick and to give them a better prognosis.
It is a far cry from the first half of 2021. COVID casualties peaked in April, reaching more than 4,000 deaths in a 24-hour period. Brazil's megacity, Sao Paulo, was averaging between 700 and 800 deaths a day. Today, it is the country's poster child for coronavirus vaccinations, with 99% of adults here having received at least one shot by November. Of course, I think people should get vaccinated, and that means everyone. Many Brazilians are afraid of the virus and get vaccinated so as not to be contagious. Brazilians believe in vaccines. After all, we have been getting vaccinated against tropical diseases for a long time. We like it. But while Brazil may have turned a corner in fighting the pandemic for now, there is one persistent problem. Poverty has been exacerbated. Ordinary Brazilians are struggling. Earlier in the year, we met Silvia de Jesus, a cook who was supporting 3 other adults, as the only one in her family to still have work, albeit just 1 day a week. She used to work other jobs too, but her other employers let her go for fear of infection.
This pandemic is difficult. It's going to leave all of us starving, and that's apart from all the damage it does to your health. Look at this queue. We're all in the same boat.
Every afternoon, Sylvia was queuing up for food donations. Since the beginning of the pandemic in Brazil in March last year, the Residents Association has been distributing rations. The latest figures show the economy stagnating and inflation rising, food prices increasing, while jobs remain few and far between. While the worst may be over, the pandemic is still ravaging Brazil, bringing poverty and hunger to more and more people.
And let's get more now with Fabio Leal, a research doctor specialising in infectious diseases. Thank you very much for joining us, Fabio. What's your opinion on why Brazil has been so quick to take up the vaccines?
Thank you for having me here, Daniel. Well, I think that, and we've known that for sure for decades, that the main reason for the success in Brazil with vaccination is the public health system that is universal in Brazil, so free for every Brazilian. And within this system, there has been for decades a very complex and efficient vaccination system that has worked to get even to very remote areas in the country. So we created a culture of vaccination as well as the infrastructure needed to get to every Brazilian as quick as possible.
And so it was that infrastructure which already existed that overcame the resistance from the top of national government, would you say?
Yes, especially because this healthcare system that we have in Brazil, that is similar to what has been a reference in the UK, provides institutional structure. So it's very solid. So our institutions are stronger than any provisory or temporary government that might not be supporting this system as much as needed. So obviously there were several and major limitations because it's been underfunded chronically, but still it's in place and working. And it has the population, more than 75% of the population actually uses this system regularly. And it's structured in a way that locals are agents, are community agents that knock on people's doors and follow the health situation of the entire family. So they rely on this system. The Brazilians rely on this public health system, and that's why vaccination was not such a new idea or challenging idea, despite all the difficulties that we had with communication.
And just goes to show how important that kind of long-term investment in education around vaccines, especially around infrastructure, how that really pays off. But when we look to the short term, is it time for Brazil now to open up for New Year, open up for Carnival, as some politicians there are suggesting, or is that just too early?
Well, we are going through a new moment. We are learning as time goes by how to deal with the pandemic, and not only from the perspective of the virus and disease, but also as a community, as a global society. So after 2 years of going back and forth with lockdowns and strict measures, we have to learn how to better handle the situation, because it's a much different situation from what we had 2 years ago. As was mentioned, in Brazil, we have the majority of the population in major cities like Sao Paulo and Rio. Over 90% of the adult population is fully immunized. So even if we have a surge of cases, which is likely to happen, is already starting at this point, like we see in Europe and North America, we expect that hospitalizations and the death toll will be very different and a lot smaller than we had in previous waves. So hopefully, and we are preparing for that situation, we will deal with mild disease that will actually create a pressure on the healthcare system, but not in hospitalizations and death tolls.
Okay, and you're mentioning in that factoring in the Omicron variant and the new wave which could come from that. So that flexibility is important there as well with dealing with new variants. But I want to move on to, as we saw in the report, the fact that poverty has worsened in Brazil. What's the connection in Brazil between poverty and COVID?
Well, it's a direct connection, as it is, I think, worldwide, because as we have to slow down the economy and all the activities, the social activities, those who are more vulnerable have less opportunity to earn their basic needs, and that creates an even bigger difference between those who have more of the funds and the money from the country and those who have less access. So this is increasing this difference in Brazil and in many other parts of the world.
All right. Well, it's plenty of lessons to learn from Brazil, it seems. Fabio Leal, thank you very much for that.
Thank you.
And now it's time for you to ask and for us to answer. Here's a viewer question for our science correspondent, Derek Williams.
Can vaccines end the pandemic?
You know, it's interesting to look back on nearly 2 years of reporting on this pandemic and realize how much our ways of thinking about some things have changed over that period of time. Remember, for instance, when we all more or less thought that if we could just manage to vaccinate 60 to 70% of the world, then we'd hit herd immunity and SARS-CoV-2 would be conquered and would just sort of magically go away. Well, along with vaccine hesitancy in many places, the arrival of new, more highly transmissible variants and waning vaccine-induced immunity have kind of put paid to that idea. Experts don't talk about herd immunity much anymore. And I think that's because it's always been pretty closely associated with the thought that we'd be able to eradicate COVID-19. And most scientists no longer believe that we'll be able to do that. In fact, most think now that the declaration that the pandemic is finally over, when it comes, that it'll be less of a bang and kind of much more of a whimper. For most experts, the goal has stopped being to wipe out the disease entirely, but instead to manage it as we do others. And that's where vaccines will play a really major role. Though the evidence indicates that vaccines don't do as much as we'd like to hinder the transmission of SARS-CoV-2 or to stop infection with the virus entirely, they do generally prevent the development of severe symptoms that can lead to hospitalization and death. So, in that sense, vaccines can end the pandemic, not by helping us to wipe out SARS-CoV-2 completely, like the smallpox vaccine wiped out that pathogen, but instead by protecting enough people well enough that one day we'll be able to live with COVID-19 like we already live with the flu.